Hello everyone, my name is Dr. Sikandar and today we will discuss about the lymph node stations in the lungs. So let's start. Station number first. So station number first, it could be either left or right. So we will call them lower cervical lymph node or supraclavicular lymph node and external notch nodes. So these all are the lymph node station 1. So like what defines upper border of lymph node station 1? So lower margin of cricoid cartilage is the upper border and the lower border is made by clavicle bilaterally and in the middle the upper border of manubrium, and they are telling like 1R designates right sided node, 1L is left sided node in this region. L1 and R1 are limited by the midline of the trachea. So we will make a midline here. So right to it are the right nodes and left to it are the left node, and upper and lower border we have already discussed. So these are so here we can make a line. So like from upper border of the manubrium and the clavicles bilaterally, upper portion of this is made by lymph node station 1. So let's discuss about the lymph node station 2. We call them upper paratracheal nodes. Upper paratracheal nodes. So yeah, they could be either right or left. So in right-sided, upper border is defined by the apex of the lung and the pleural surface space. So bilaterally there is like apex of lung and pleural space is there. And in the midline, the upper border of the manubrium defines the upper border of the upper paratracheal nodes. And what defines lower border? So they are telling intersection of the caudal margin of innominate vein with the trachea. So yeah, here we can see this is the innominate vein. So like lower margin of this innominate vein defines the lower border of lower border of this upper paratracheal nodes. So upper border is made by apex of right lung, pleural space in the midline, upper border of the manubrium, and lower border is made by the intersection of caudal margin of innominate vein with the trachea. And in the left side, they are telling apex of upper border is defined by the apex of the left lung and pleural space, and in the midline upper border of manubrium, which is similar to right side. And in lower border is defined by the superior border of aortic arch. Very very important. So they are telling like lower border, this is like aortic arch ka superior margin. So it is superior border of aortic arch which makes lower border of this upper paratracheal nodes. So yeah, they are telling like yeah, okay. So both lymph node station 2 and lymph node station 4, the oncological midline is along the left lateral border of trachea. So this left lateral border defines the midline for these lymph node station 2 and 4. So right to it are the right sided and left to it are the left sided. It is not the midline from the trachea. It is from the left lateral border of the trachea. Very, very important thing we should have in the mind. So yeah, now they are talking about the lymph node station 3. It is either prevascular and retrotracheal nodes. So they are telling like prevascular on the right side, upper border is made by apex of chest, lower border is made by level of carina, anterior border is made of by the posterior aspect of the sternum. So yeah, these three things are similar, but the posterior border is defined by the anterior border of the superior vena cava. So yeah, anterior border of superior vena cava makes the right posterior border of right-sided prevascular lymph node. While on the left side, all these three things like upper border is made by the apex of chest, lower border is made by the level of carina, anterior border is made by the posterior aspect of the sternum, and the posterior border is made by the left carotid artery. Means like this is like different. And there is a 3P. What is 3P? 3P is like retrotracheal or prevertebral. So yeah, upper border is made up by the apex of chest and lower border is made by the carina. And these lymph nodes are like posterior to these like vascular structures. So posterior to these vascular structures are the retrotracheal or prevertebral lymph nodes, and anterior to it are like prevascular lymph nodes. Now they are talking about the lymph node station 4, which is also known as lower paratracheal node. Lower paratracheal node. So in right side they are telling includes right paratracheal node and pretracheal nodes extending to the left lateral border of trachea. Yeah. So yeah, we know like left lateral border makes the difference between right and left. Now they are talking upper border is made by the intersection of the caudal margin of innominate vein with the trachea, which was the lower border of those those like upper paratracheal nodes. While the lower border is lower border of lower paratracheal nodes are made up by the lower border of the azygous vein, very important. So lower border of azygous vein makes the lower border of lower paratracheal nodes. So everything is lower, lower, lower. Then comes in the left side. So they are telling the upper border is defined by the upper margin of the aortic arch, very, very important. And the lower border is made up by upper rim of the left main pulmonary artery, very, very important. So upper rim of the left main pulmonary artery makes the lower border, and the upper border is made up by upper margin of aortic arch. Now they are telling about the subaortic or aortopulmonary window. Subaortic lymph node are lateral to the ligamentum arteriosum. Subaortic lymph nodes are the lateral to the ligamentum arteriosum. So upper border is made up by the lower border of aortic arch, and lower border is made up by the upper rim of the left main pulmonary artery. So these are subaortic lymph node, and these are present in aortopulmonary window. Then comes lymph node station 6, which are para-aortic nodes. And these used to be present like either in ascending aorta or phrenic. So lymph node anterior and lateral to the ascending aorta and the aortic arch. So they are like normally lateral to the ligamentum arteriosum. So upper border is made up by the a line tangential to upper border of aortic arch, and lower border is made up by the lower border of the aortic arch. So these are like along only aortic arch. So upper border of aortic arch and lower border of aortic arch makes the upper and lower border of these para-aortic lymph nodes. While the subaortic lymph node upper border are made up by the lower border of aortic arch and upper rim of the left main pulmonary artery. Very, very important. It was present between aortic arch and the left main pulmonary artery, and these were lateral to ligamentum arteriosum, while lower paratracheal lymph nodes were medial to this ligamentum arteriosum. Now they are talking about the subcarinal lymph nodes. So upper border of subcarinal lymph nodes are made up by the carina of trachea. Carina of trachea makes upper border of subcarinal lymph node, and lower border is makes up by the upper border of lower lobe bronchus on the left and the lower border of bronchus intermedius on the right. So yeah, as we know, like right-sided lower right side there is a presence of bronchus intermedius. So the lower border of bronchus intermedius and upper border of uh, left lower lobe bronchus makes the lower border of subcarinal lymph nodes. Then comes para-esophageal nodes, which are below the carina. So nodes lying adjacent to the wall of esophagus and to the right or left in the midline, excluding the subcarinal lymph nodes, are known as para-esophageal nodes. Upper border is made up by the upper border of lower lobe bronchus on the left and lower border of bronchus intermedius on the right, which were the lower border of those subcarinal lymph nodes. And these this thing makes the upper border of para-esophageal nodes, and lower border is made up by the diaphragm. Then comes the pulmonary ligament node. So these nodes lies within the pulmonary ligament. So upper border is made up by the inferior pulmonary vein, very, very important. Inferior pulmonary vein makes the upper border, and lower border is made up by the diaphragm only. Then they are talking about the lymph node station 10, which is hilar lymph node. They includes node immediately adjacent to the main stem bronchus and the hilar vessels, including the proximal portion of pulmonary vein and main pulmonary artery. So upper border is made up by the lower rim of the azygous vein on the right and upper rim of the pulmonary artery on the left, while the lower border is made up by the interlobar region bilaterally. Interlobar region makes the lower border. Then they are talking about the 11, 12, 13 and 14 lymph node stations. So 11 lymph node is like interlobar nodes, and then comes lobar nodes, which is station 12, which are adjacent to the lower bronchi. Then comes segmental nodes, which are adjacent to the segmental bronchi, and then comes subsegmental lymph nodes, and these subsegmental lymph nodes are adjacent to the subsegmental bronchi. So let's revise what are the lymph node stations and what are their names. So station number 1 was supraclavicular or supraesternal or lower cervical lymph nodes. Then comes lymph node station number 2, which were upper paratracheal lymph nodes. Then comes station number 3, A and P. 3A was like prevascular lymph nodes, and then comes 3P, which were like prevertebral or retrotracheal lymph nodes. Then comes station number 4, which were lower paratracheal lymph nodes. Then comes station number 5, which were like subaortic lymph nodes. Then comes station number 6, which were para-aortic lymph nodes. Then comes station number 7, which were subcarinal lymph nodes. Then comes station number 8, which were para-esophageal lymph nodes. Then comes station number 9, which were like lymph node along the pulmonary ligament. Then comes station number 10, which were hilar lymph nodes. Then comes station number 11, which were interlobar lymph nodes. Then comes station number 12, which were lobar lymph node. Then comes station number 13, which were segmental lymph node. Then comes station number 14, which were the last lymph node, which were the subsegmental lymph node. So that's it. This is the whole thing about the lymph node stations in the chest. Thank you so much.